Hello, I'm Giovanna, International Clinical Manager from Vindense Medical. In this class today, we're going to talk about GoSmooth. First, the laser, the light, the science, and the technology. When you're looking on the absorption curve, we can see melanin, hemoglobin, and water. When we are going to work with non-ablative or ablative laser, that is the case here, we are going to look and we need to pay attention on the water, okay? And here we can see in a blue line. Comparing ablative laser with non-ablative laser, we both has absorption from water, okay? But ablative laser has more absorption from water, so it works with vaporization. Non-ablative laser has less absorption from water, so it works with coagulation of the tissue. Thinking about, for example, rejuvenation, normally with ablative laser, we're going to do less sessions, but with higher downtime. With non-ablative laser, we are going to do more sessions, but with low downtime. Comparing ablation and coagulation, ablation, we are going to do vaporization of the tissue because it has more affinity for water. And coagulation, we're going to have inflammatory effect of the tissue, less absorption from water. Here we have a graphic comparing ablative laser and non-ablative laser. And we can see here that non-ablative laser, we have more penetration of the laser, and we work with coagulation of the tissue. With ablative laser, we're going to do vaporization, and it's superficial. In this slide, we can see the different kind of non-ablative laser that we can find at the market. In our Etherea, we're going to work with 1340 nanometers, our ProDeep, or 1540 nanometers, our GoSmooth. Both has absorption from water, but comparing them, it's possible to see that 1540 has more absorption from water. Okay, and because this 1540 is more superficial than 1340. So GoSmooth is more superficial than our ProDeep. In this slide, we can see a biopsy that was did by Dr. Luisa Pitassi, and we can see the coagulation of the tissue. We can see the epidermis is integrated. Pros about non-ablative laser is the reduced downtime and low risk of hypopigmentation. The cons, the number of sessions, okay? And sometimes it's necessary to do more than one pass in the area that we're going to treat, sometimes, okay? Features and technologies about our GoSmooth. It works with square spot size, and the 1540, this wavelength is best known in the market, so it has several publications about it. Our handpiece is named as GoSmooth. We are going to work with erbium glass, 1540 nanometers. We have 2 pulse duration, 10 or 15 milliseconds. The energy up to 95 millijoules for microthermal zones. And we have 2 spot size, 80 millimeters with 100 microthermal zones and 10 millimeters with 400 microthermal zones. With 100 microthermal zones, we have less density, but it's possible to work with more energy. So 100 microthermal zones is deeper. 100 microthermal zones, we're going to have more density with low energy. So it's going to be more superficial. And it has integrated the cooling cooler. Okay, we can put our Siberian, for example, or another cooling system together with the handpiece to do the treatment. to make it comfortable for the patient and safer for us, okay? Here we have the screen, and we can see the pulse duration, the energy, the fluency, the frequency. The frequency we are going to change according to our hand, and we can see the spot size with automatic recognition. Care and maintenance about our GoSmooth. It's very important to clean after the treatment. You're going to use just alcohol, clean all the spot size. And we have the warranty in 500,000 shots. If you need to learn more about the cleanings, the maintenance, you can see several videos in our YouTube channel or in our site, evidenceLaserAcademy.com. Talking about practice in our clinical treatments, here we have the indications. So with GoSmooth, we can do rejuvenation, non-ablative or flashing or resurfacing. We can treat stretch marks. We can treat acne scars or surgical scars. We can do melasma, alopecia, and we can use for pigmentary lesions too, okay? To do aggressive treatments that we need more penetration, normally we're going to use 100 microthermal zones. So for example, to do rejuvenation, stretch marks, or different kinds of scars, acne scars, for example, it's going to be necessary to use 100 microthermal zones. For melasma and alopecia, normally we are going to use 400 microthermal zones. The interval between the treatments are going to be 30 days. Number of sessions, 3 to 7. The patient is going to have edema and mild erythema, so the dwell time is not too high, but it happens just a little. And it's very recommended to use some drug delivery after the treatment to increase the results. If the patient has some kind of pain, it's possible to use a numbing cream, but it's very important to remove it before the treatment. Okay, not to do the drug delivery with the anesthesia cream, okay, the numbing cream. And if it's possible, we can put together our sedating on another cooling system to reduce the pain, to make the treatment more comfortable and more safe. As I told you, we have a lot of publication about 1340, and here we have the bibliographical reference. If you need to learn more about it, or if you have some doubt, just ask us, okay? We are here to help. Thank you.